So my name's Tyrell Ingram. I'm a Wiradjuri man, born in Leeton, grew up in Wagga. Strong connections within the health and community service sectors in Wagga, and we moved over here to Albury-Wodonga in 2015. Yeah.
Hi, my name is Jovie, and so I'm married to Tyrell. I'm a Filipino woman and was born and raised in Wagga. I engaged with the Aboriginal Medical Service in Wagga when I was pregnant with Hannah, and so that was back in 2000. And I was very fortunate to have had the support from Tyrell's immediate family, his mum, and have been engaged with the health system there for through the 2 pregnancies, and have had positive interactions and outcomes with the service providers.
Yeah, look, I think that the Aboriginal Health Service has been for us when we were young parents. We're only 18 when we had our first child, so it's all big learning. My family is certainly very supportive, and Jovie's family was very supportive as well. But, that engagement that we got from the Aboriginal Medical Services was invaluable in terms of, those early years needs for the children that as young parents we probably weren't really around. And kind of looking back, we were probably a little bit sort of naive about those sort of things, and the medical service was really supportive around and explaining us, the values of really trying to make sure those early years were quite flourishing for the children. I reckon it's really about listening. It's that fundamental step, and listening to your clients' concerns and really validating those concerns. Being involved in case coordination, I think, is really important. And as with any meetings that take place, the more professionals and the diversity of those professionals, the better the outcomes are going to be for the client. But I would say that it needs to be client-centred as well. You've got to engage with your client. This sitting behind the desk, telling people how it is really not. It's not a holistic approach. You need to take into account the whole life experience of that individual, and making sure that they understand what's going on, and that you're going to work with them to overcome any of those issues.
Yeah, be flexible in their approach to delivering a health service to a patient, and look at alternative ways. Like, not everyone's going to be able to get to a service, and it's not going to be just a typical appointment. I think the best outcomes we've had with our children is that it has not only happened at a health service, but external to a health service. So through the schools, through the Parent as Teachers program, and that access to health promotion and information, and kind of going on that journey with a patient, and really valuing that holistic approach to health and their family as well, and extended family. Personally, our experience with some of the health challenges we've had with our children, we haven't just done it on our own as a nuclear family. We've had, if it wasn't for my mother-in-law, who really kind of was translating some of the stuff I needed to know around, and concerns, and make sure you ask this question and things like that, I think, it would have been very challenging for us.